A concept that underpins how I approach repeated movement testing and treatment, but also tendinopathy management or muscle lesion management or any number of things coming back from a ligament sprain, is produce, not worse. And I use those words on my forms, and what they mean is that during the specific movement, within certain parameters, mind you, we can produce symptoms as long as after the patient is not worse. And that also comes with specific rules. So what I mean by this is, for example, say you're coming back from a ligament sprain and we want to reincorporate jogging, I may allow jogging that produces a mild symptom of like a 1 or a 2 out of 10, but the patient cannot be worse later that day, worse that evening, worse the next morning. That kind of philosophy applies in that regard to tendinopathies as well. If we are loading the tendon in a specific direction to remodel a tendinopathy, or if we're doing a load such as returning to function like jogging or playing a racket sport, we may be able to produce a certain amount of pain. Again, I'm keeping it mild, possibly up to moderate for certain circumstances, but afterwards, later that day, the next day, the person cannot be worse. And that means symptomatically, but that also means mechanically. They cannot be worse in terms of range of motion or strength or swelling, etc. But going back to the first word, and I use produce as in the column of during the action, right? So we can produce 1 or 2 out of 10 pain. Not worse is the after effect. Repeated movement testing is where this nomenclature came from Robin McKenzie's Mechanical Diagnosis and Therapy. And so that's where I really use the words. And what I want to point out today is when we talk about produce, for the ligament, for the tendon, it's obvious, right? We don't want to produce mostly that symptom in the ligament or that symptom in the tendon, but if there can be diverse symptoms we're also assessing. But for repeated movement testing, when we're moving a joint in a specific direction, say we're doing neck retraction and the patient's primary complaint, let's say, is headache and left-sided neck pain. When we go into retraction, if that produces something that the patient does not have at rest, if the person has the symptom at rest and doing the movement increases the symptom, I use the terminology increasing. But if it's not there at rest and it produces a symptom that wasn't there or makes the symptom that wasn't there appear, I use the word produce. So we do neck retraction and that produces right neck pain, or that produces a little right ear pain or left jaw pain. I will note that it produces that symptom during the movement. And again, then we're assessing afterwards, does that right neck pain remain? Does the ear pain, the jaw pain remain? And if it doesn't, after a few minutes, or if it's mild and only lingers for half an hour and then abates with more time and abates with more repetitions throughout the course of the day or the next day, then we don't call it worse. Again, there is nuance to using these terms. It is not necessarily black and white. I need to understand what I will allow us to produce, how I will define it, and what I will claim is worse or not worse. But that also goes for producing the person's symptom that they're complaining of. So if we go into neck retraction, it produces a small headache, it lasts for 10 minutes, but it goes away, and mechanically we see improvements. That's a yellow light. That's an indication to keep going. Producing the headache that now remains for 2 hours and is worse than it's been in days, that is a worsening symptom presentation. It's probably accompanied by a worsening mechanical presentation, meaning we are now losing range of motion as well, possibly strength in certain situations. So that would be classified as produce worse, and we would not continue with that specific movement. We might try different load or a different amount of force. That means we're not necessarily giving up on retraction as a whole, but we are not doing that specific intervention we just attempted. So producing can be producing symptoms that the patient did not complain of before, producing symptoms that they're complaining of but they didn't have at the time of movement. And sometimes it's also producing symptoms that seem very distant, right? If the person has had in the past, their fingers go numb, and now we're doing some retraction, and every time we do it, they get a kind of that zing of paresthesia or that weird feeling in their fingers, and it goes away, then we are producing hand paresthesia. That is not worse. So these kind of conversations are pretty much what's going on with the patient in the room. Again, office visits with me are not coming into my office and me telling you, go do the bike, go get on the heat pack, go do some strengthening with the bands over there with the assistant or the aide. They're very much not that much movement going on. I am testing a movement and really diving into what happens when you do specifically shoulder functional internal rotation 10 times. What happens when you do knee extension with overpressure 20 times? What happens when we do retraction? If we do 10, 20, 30, is it producing your symptoms that you didn't have at rest? Is it producing distant symptoms? Is it producing new symptoms? And what happens after? I'm taking the symptoms before and after. I'm also, of course, taking the mechanics, looking at range of motion, looking at nerve tension, looking at strength, looking at other functional baselines or other baselines that are less common to take. And we're really assessing in that column what's happening during, what's happening after. And that really dictates where we go with treatment. We want to look for something that it might produce some symptoms when you do it, but afterwards, over the course of minutes, hours, or days, things symptomatically, things mechanically are better. The word I would use in that second column in that case is better. So we have various words that I use for the produce, no worse. We also have increase, not worse, or reduce, decrease, better, or decrease, abolish. We're looking for, again, what happens during, what happens after. We have rules that we allow, but overall, people get a little bit nervous or fearful or scared if they're doing the retraction and it hurts when they do it. But I tell them sometimes the analogy of look, pulling out a splinter hurts, but we gotta do it. Or resetting a dislocated shoulder hurts, but we gotta do it. But there are rules. It cannot remain worse significantly after. We cannot lose mechanics. So I'm constantly reassuring people that, look, I'm okay with you temporarily producing that zing down your arm when you extend your neck. I'm okay with you getting a mild kind of headache that lasts for 5 minutes when you do it. I'm okay with symptoms that you haven't had before getting produced if the other rules apply, and afterwards it's not remaining worse. And afterwards, over the course of, again, minutes, hours, or days, we're seeing positive changes both symptomatically and or mechanically.